is an international movement that is providing the trappings of a cafe, but we're talking about death. Everything from how you want to be remembered to a healthcare proxy.
I'm in charge of the Before I Die station. So what this is people write down what they want to do before they pass. Personally, I was a little nervous to start with the station. I thought people would feel uncomfortable talking about it, but I've been pleasantly surprised.
The thing that I really wanted to do is go to a sculpturing class.
Travel to Hawaii.
People want to go meet Rihanna.
I would like to take my family on a cruise, win the lottery too. So to make that cruise possible.
One of the reasons I wanted to do the Death Cafe is because when you look at the statistics, here in Nassau County, it's over 50% of Black non-Hispanics are dying before the age of 75. And the idea that these are, people are dying at these rates that are much higher than they are among other populations made me realize that there's a real need to be able to address these issues.
It's important to talk about end-of-life issues because in a way it's kind of frightening. I moved into housing in 2006, and when I moved in, I told my wife, I said it would be great if that we could start a program to help people. And then in this year, this program came to us, outreach from NUMC and Hofstra, and my goal was filled.
I was working at the health proxy station, and it's a very important conversation that we need to bring up with these senior citizens. It's a very difficult conversation for people to have, so it's really important to emphasize why it's important for them to fill out a healthcare proxy form and make sure that their family members know their wishes and desires.
What my goal is for my students is for them to be able to understand the face-to-face, the personal look of how this appears in real life, and I want them to be able to know that they can connect to people and help them to have better health outcomes.
You're actually talking to people, It's not just about, curing someone. It's, bedside manner. It's talking to people. It's getting to hear what they have to say, their hopes, their fears.
I've already told my son, he said, "Mama, I don't want to hear the conversation anymore." I said, "I just want you to be prepared. You're going to cry and you're going to mourn, but I want you to have the memories of what I did and how I lived my life."